So, welcome, Derek, and welcome, Yusuff, to our podcast episode today. And before we speak about your very recent publication, why don't you both very quickly introduce yourselves to anybody who is new to harm reduction? And Derek, would you like to go first?
Yes, Derek Yach. I've spent too many decades in tobacco control to count, many years at WHO, and then headed the Foundation for a Smoke-Free World for many years. And my interest and passion was in trying to address the end of smoking worldwide, initially through the WHO Framework Convention, and in the last few years, recognizing that we can make complementary and even faster progress if we adopt and embrace tobacco harm reduction around the world.
Thank you, Yusuff. How about yourself?
I'm Yusuff Adebisi, and I have some level of experience in doing THR research, especially in low and middle income country. I've done some research to understand THR in Africa, and presently I'm doing my PhD, and I'm looking forward to doing more research to explore and understand THR when it comes to its impact and how we can actually maximize its benefit for low and middle income country.
Fantastic, thank you. So now we're going to talk about your very recent publication, which came out in February, called Understanding Research Gaps and Priorities for Tobacco Harm Reduction in Low and Middle Income Countries. And in fact, on the SSRN network, which is the Social Science Research Network part of Elsevier, it was the top download for that month, I believe. So big congratulations on the success of your publication. So Derek, I'd like to start with you. Would you mind introducing the report, please?
Sure, and I was thrilled to work with Yusuff and his colleagues on doing this. Um, the background really goes back to work which I was doing on HIV/AIDS over 30 years ago with colleagues in Kenya and Zimbabwe, where we documented the fact that the vast amount of research and research funding around HIV/AIDS came both from the US and was carried out by US researchers and often ignored the local circumstances, didn't really lead to local capacity building, which meant that solutions were not necessarily the best solutions for the African continent, either in terms of price and cost. So in this study, we set out to look at what is the story and the current level of investment in tobacco harm reduction research, knowing that it's essential, particularly in low middle income countries where the vast majority of smokers live and die. And we also based it on the underlying assumption that if you have researchers carrying out important work in their own countries, they're more likely to become advocates for better policy. And the local politicians are more likely to listen to the voice of research from their own country. And so we really set out to look at what is the current status of global health research, research at the national levels, the size of the gap between developing country and developed country research, and whether there are differences by private and public sector funding, or with a view to asking the question, how can we make sure that science-based solutions have a faster impact on ending smoking?
And this is a question for both of you now. I don't mind who goes first. But what motivated you to conduct the review, and why did you specifically focus on THR in lower middle income countries?
This is because most of the time, the research that we have that is driving discussion when it comes to tobacco harm reduction tends to come from high income country like the UK, the US. So what do we know about low and middle income country? What are the present research that we have? And the aim of this review is to look at the present evidence to quantify it and show that indeed there's a major disparity when it comes to tobacco harm reduction research. And that calls for more attention so that we can maximize this benefit of this life-changing innovation for the betterment of everyone. And in fact, majority of smokers, according to WHO, actually lives in low and middle income countries. So why should they be excluded? So we don't have enough discussion around this, and that's one of the motivations to see what are the current evidence, what do we have presently, and to look at the scope of the research that is available, and also to start a discussion around that and why we need more investment when it comes to tobacco harm reduction research in low and middle income countries.
Anything to add to that, Derek, or should we move on?
Just very briefly,
Mhm.
when we put together the framework convention, you'll see that there are two or three specific areas where they highlight the importance of investing in research for exactly the reasons we highlighted. Unfortunately, with the exception of a few initiatives, most of which have gone away now, the amount of research going into tobacco harm reduction and tobacco control research in general remains extremely low. There were initiatives through the NIH, through the International Fogarty Center, and I was sat on the board for that for a decade, and we're making good progress. There were efforts by the Canadian government through IDRC and through the Wellcome Trust, but in general, most of those have actually ended. And our concern was also that the absolute amount of research being done for low middle income countries remained extremely low. Of course, this has been made substantially worse now by the massive cutoffs of NIH funding through the US government. And I look at my own country, South Africa, which is one of the largest international recipients of NIH funding. And they basically had their international funds cut to zero. Not that it was supporting much tobacco harm reduction research, but it shows that the size of the problem is massive.
Yeah. And as you both have explained, that THR research is dominated by high income countries, and actually specifically e-cigarettes primarily. What do you think are the implications of this trend for tobacco control policies in LMICs?
Maybe Yusuff, you start.
Well, in this case, it's likely to lead to some level of disparity in our understanding of how best we can maximize this product. And in fact, we have seen some countries that are making policy based on the research found or reported in other countries and high income country without generating local evidence to understand how best we can actually leverage this product to quit or to reduce smoking rate when it comes to low and middle income country. So the major issue here is that there's a need for collaboration. There's a need for different sectors to come together to see how best we can maximize this product and make sure that smokers have access to them, and to understand how best we can actually maximize or use this product to improve public health in low and middle income country. And this disparity generally is going to actually lead to some level of mistrust from both sides of the discussion, because in public health right now there's a major division, and this division is actually driven by, oh, okay, public funded research talks about this, private funded research actually talks about this. And in fact, we have a number of public funded research that also point at the benefit of this product. But the general misconception or mistrust is actually tend to persist when we don't have enough research, or when we don't have research to actually justify the need for this product in low and middle income countries. For instance, we have a number of research in high income countries that has shown to us that, see, e-cigarette is a lot safer compared to combustible cigarettes. So, what of how best and how can we implement this product in low and middle income country? There's no enough research. Do we really need to reduce the price, or do we need to do some product modification, or is it that nicotine pouches or snus is going to do better when it comes to Africa or when it comes to Asia? We don't have that research yet, even though there are enough research that has shown to us that this product, they are indeed reduced risk products. So how can we maximize? How can we benefit from this product? The level of disparity when it comes to cooperation between public sector and private sector is something that needs to be discussed more, on how best we can need we as researcher, healthcare professionals, policymakers, stakeholders from the industry, everyone needs to come together to drive this innovation, to understand how best we can make use of this life-changing innovation. Because any effort to actually reduce access to this product, indeed, we are saying people should continue to smoke. That's what any effort to say tobacco harm reduction products should not thrive simply means that people should continue to smoke. And that means that we are actually limiting innovation. So there's a need for that collaboration, which is presently lagging, or we don't even have, between the public and the private sector when it comes to tobacco harm reduction.
Some very good points.
Yeah,
Derek, do you have
and
any further comments?
Yeah, I'd say, Jessica, I'd add the harsh reality is that the agenda in the US and Europe, and US is where vast majority of funding and research is carried out, tend to prioritize youth and kids. And the big concern is how are we going to stop kids ever using vapes and cigarettes? And much less work is focused on adult smokers in middle age, which is where all the damage happens. Now, that may be all right for the US, where the smoking rate is now heading down below 1 or 2%. But in the vast majority of the low middle income countries, smoking rates among men, particularly, are in excess of 40 or 50% in Indonesia or China or parts of the Middle East, parts of Eastern Europe. A very different reality. And bringing their smoking rates down, the adult smokers of today will actually save more lives over the next 20, 30 years than doing anything about the kids. And yet the focus of research tends to copy what we're getting on terms of kids. So to give you some examples, we have extremely high levels of lung cancer, COPD, tuberculosis, cardiovascular disease, all driven by smoking across many of the low middle income countries. And the research on the benefits and the effectiveness of switching or cessation is virtually non-existent. And as Yusuff said, our view is that we need to both expand the amount of research in general, but particularly focus on the adult smokers and how you can bring the death rates down and improve their quality of life through a range of combination of different approaches, heated tobacco products, vapes, snus, nicotine pouches, and across the Middle East, e-shisha are all examples of alternatives which won't kill you, knowing that it's the smoking and the combustion that kills.
Hmm. I'd like to also talk a bit more about the NIH issue, which you mentioned earlier. So, recent actions by the Trump administration have led to significant cuts in funding for the NIH, affecting not just domestic but global research initiatives. And in fact, there's been a freezing of 47 billion in the budget. So, talk to us a bit more about the effect this is likely to have on research and public health, but especially that could affect lower middle income countries as well.
Well, they are, as I said, through the National Cancer Institute of the NIH, and as well as through the Fogarty Center, which is the international office, they have historically supported research around the world. Um, South Africa, Malaysia, a number of European countries have all benefited. Um, that is either being cut dramatically, completely, as in the case of South Africa, and so the modest amount of funding out there is going to go away. It's not as if there are many alternatives. The Wellcome Trust for a few years was funding some research, and they still have some projects around the world, but nowhere near the level needed. And the problem has been that many developing country research bodies have not prioritized tobacco control generally for research and tobacco harm reduction research at all. So the South African Medical Research Council, the Chinese, the Indians, the Malaysians, all have the financial capability and good research infrastructure to provide their own funding for tobacco harm reduction research. We hope that this report would stimulate them to take equivalent action. And I'd go further and say that there also is a responsibility for the private sector. A lot of the research carried out by the major multinationals have tended to be in advanced industrialized countries. We have a few who've been looking at, for example, the use of nicotine pouches in Pakistan or a number of the Middle East countries, which are to be welcomed, but nowhere near the size of the smoking problem or the use of smokeless tobacco problem, things that cause a lot of cancer. So generally, there is a huge gap. And while people often think about the enormous cost to infectious disease research, which will be substantial through the cuts coming through the Trump administration, they should remember that non-communicable diseases and tobacco, already severely underfunded, will simply do even worse.
Hmm. So you just mentioned some interesting points there, and the publication also points to the very low research output, like you said, in regions like Asia, Africa, and actually South America as well. So what
Yeah.
practical steps can be taken by governments to encourage more research in these regions, and how can it be made more relevant to the local public health needs of those countries? So if you both have any ideas on that, that would be great.
First, I think it is very, very important to increase funding. International bodies, governments, and even private sectors can step in to fund research. Like I said earlier, we still have major gap on how best we can maximize the benefit of tobacco harm reduction products in Africa, in Asia, and many low and middle income countries. So it is very, very important that funding should be put in place to fund more research by even by the governments of each countries, by international bodies, and in fact, our private sector. It's about collaboration, it's about working together to make sure that we bring down smoking rates. And also, it's important to build local research capacity. It is very, very important. Trained scientists, many people right now don't even know about tobacco harm reduction among some researchers. They don't know about the concept. So there's a need for more trainings, more resources. And we have some initiative like the Tobacco Harm Reduction Research Program that is already doing that. But we need more support, more investment in this line to build more capacity of people of researchers, of scientists to understand the concept of tobacco harm reduction and its benefits for public health. Because most of the time, people get their information directly from the media, and sometimes there's a lot of information out there, but without trainings from experts, from people that have the right knowledge and skills about this concept, we risk having a lot of misconception, misperception, and a lot of disinformation when it comes to tobacco harm reduction. So there's a need to build local research capacity across countries so that we can have more researchers or more experts that can lead initiative to advance tobacco harm reduction. Yeah, that's it.
Derek,
Yeah,
do
I
you have any
couldn't agree more
comments?
with.
Yeah.
Yeah, I would couldn't agree more with Yusuf. I mean, I think that the reality is we're in a tough financial era in global health generally. And to make the case for these investments is going to just get tougher and tougher over the next few years. But and that was the rationale for the creation of the Foundation for a Smoke-Free World, now the Global Action Against Tobacco. Um, I would hope we would see even greater focus on their work in low middle income countries. In fact, you could argue they should be spending 100% of their resources in low middle income countries, given the fact that there are vast resources available in the US and Europe to tackle tobacco and tobacco harm reduction. And anything we can do to both build the human capacity, which lives on for years and years in low middle income countries, will be incredibly valuable. Um, I think when it comes to the private sector, we do need to look and afresh at how we actually bridge the divide between companies committed to ending smoking. And that includes, of course, the more contentious ones on the tobacco industry side, but also the pharmaceutical industry. And I haven't seen major efforts by the pharmaceutical industry in low middle income countries to step up their work on smoking cessation research to build the research base that would be needed. And ideally, in time, we need to see them all recognizing that while there are obvious conflicts of interest, there must be ways in which we can have pooled funding put into national budgets to support tobacco harm reduction, given the enormous costs that it imposes on cancer and cardiovascular disease and so on. And remember, this comes at a time when we now are fully aware of the fact that for most African countries, the cost and the treatment of the cancers caused by tobacco are well beyond the budgetary capability, which means that people are going to seriously suffer. And the only solution is going to be a higher focus on prevention and preventable approaches, of which tobacco stands as the starting point.
Do you both have any final comments or remarks about the paper or anything related to it?
I would just add one last comment. I think what we tried to do in the paper as well was to distinguish between research needed at the global level, where you don't need to repeat the research in every single country. And these would be questions around what are the long-term effects of many of the tobacco harm reduction products, or what are the benefits and risks of nicotine? That doesn't need to be done at every country level. And we need a lot more investment in being able to get the answers out. The second type are national research, where every country should have the capability to know its own smoking rates, and not just its smoking rates, but it's got to be using methods to know whether people are using the full range of different tobacco and nicotine products so they can assess progress. They need better data on doctor and physician use and attitudes so that they can drive policy. Those would be essential national research questions that most countries should have and should be doing routinely. And then there's the work in the policy realm, where we need to think about how do you adapt what WHO discusses in the hallowed halls of Geneva to the reality of a low income setting with poor legal enforcement on the ground, what truly will work and what doesn't work. And particularly the issues around misinformation and disinformation need to be addressed through that kind of policy work.
Thank you. And Yusuff, anything from you?
It's also very, very important to look at how to share information. As Derek said, there's a need for research, transfer, knowledge transfer from different, from low and middle income country to high income country, and also from high income country to low and middle income country. So it's very, very important to provide that platform and that opportunity for knowledge transfer when it comes to tobacco harm reduction, especially from high income country to low and middle income country. But what is important here again is that it must be evidence based, it must not be biased, and at the same time, there's a need for collaboration between different sectors to come together to see how best this can be done. And that is also very, very important that we look at, or that our study is going to actually provide some insight on is what actually determines quitting, or what do we define, or how can we explain quitting smoking. So what does that really mean? Before now, quitting smoking just means you stop using combustible cigarettes. But right now, we have people trying to debate on the fact that quit or switch, or let us or stop using cigarettes, or continue to use e-cigarettes. So we have different non-standardized definition when it comes to the concept of quitting smoking. And with the availability of THR product, the idea is to quit or switch. People that find it difficult to stop smoking, so you actually switch to tobacco harm reduction product. But we all know the best thing for everyone is to stop using any nicotine product. But we know in the real world, this is not easy to achieve. So it is very, very important to standardize what is the definition, or what does it mean to say someone quit smoking. It is very, very important to explore that.